My name is Professor Barry O'Reilly. I'm a clinical professor in obstetrics and gynecology at the Mater Private Network here in Cork, and I also work in the Cork University Maternity Hospital. It's been an aspiration, I think, of mine for many years to have a facility dedicated to women's health in Ireland. There is no other comparable centre, as far as I'm aware, in Ireland, nor in British Isles or Europe, which is dedicated to women's health and gynecological needs. We have a lost generation of women over the last 20 years who weren't able to avail of HRT, for example, because of the scares. But thanks to the likes of Joe Duffy, for example, we've had a huge awareness campaign for menopause. The Centre for Women's Health is going to address and look after the needs of women from all ages, from 16 years of age right up to beyond. And clearly there are multiple different gynecological issues that women experience, whether it's menstrual dysfunction, painful periods, endometriosis, an enormous issue that's very poorly addressed in this country. The care for women antenatally, I think, is a very important aspect of what we'll be offering here. Clearly the babies will be delivered in the maternity hospital, but again, after pregnancy, it's a time when women are very often overlooked and not cared for in terms of the issues with pelvic floor, prolapse, urinary incontinence, fecal incontinence. These are issues that we'll be addressing here in our urogynecological service. Pelvic organ prolapse, a huge issue. 1 in 2 women suffer from that in this country, again, often overlooked. And delighted to be able to offer that type of rapid access service to women here through our pessary service, through our urodynamic service, through our expert continence nurse advisors. We will also be looking at areas like genital urinary syndrome in the menopause, recurrent cystitis, a huge issue, huge drain on healthcare resources, huge impact on quality of life of patients. And again, with our urological colleagues, we'll be offering multidisciplinary care for those patients also. I've been a consultant in Cork for 18 years, and I have a lot of personal friends who work in primary care, GP colleagues, and the constant complaint that they have when we speak to each other socially or even professionally is a difficulty with getting access to hospital-based services. It's hugely frustrating for them. It's hugely frustrating for their patients that there are delays in this and there's no seamless pathway to expertise. So I think the Mater Private Network has always been very positive and proactive in that, in for example, cardiology and other services, but not yet in women's health. So this is addressing that issue, and it's going to be a fantastic initiative and service for the primary care physicians in Munster. Women will come to this centre because, very simply, there is nothing of a similar nature in this country, never mind in Munster. So it's a fantastic one-stop shop where GPs can have rapid access to the consultant gynecologists here. And through us, we will have our colleagues in cardiology, colorectal surgery, pain management, all working together as part of a multidisciplinary team to ensure an excellent service for women. I moved to the Mater Private Network 2 years ago for this precise reason, because the Mater Private Network shared the vision I had for a Centre for Women's Health, a centre of excellence, a centre that doesn't really exist in this country as far as I'm aware. It's the single biggest investment by the private healthcare sector into women's health, and I'm immensely proud of the support I've had from the Mater board, locally from the manager Martin Clancy, in making this dream and vision a reality.